and welcome to the Innovate Talk Show. Innovate is an organization that educates and empowers medical students and doctors to learn about the changing healthcare system. I am one of your co-hosts today, Dr. Patch Adams, and this is my good friend Paladine, and of course we have the distinguished co-host, Dr. Charles Darwin. Charlie boy?
I don't know what idiot paired me up with this clown, but sometimes you just take the jobs that you're given. I'd like to introduce my dear friend Harriet, the Galapagos tortoise.
Oh, but of course.
I understand that he's a bit small, but, you know, some of them are maladapted. And I'd like very much to thank our live studio audience today. Everyone give them a nice round of applause.
Yes, yes, yes. Justin, now in rotations, we understand you do get graded. You mentioned the shelf exams. There are letters of evaluation. Please explain to us how you get this grade in rotations. It's very different than the basic sciences with the systemized test book and examinations. So please give us some light to that.
Yeah, so most of the grading is going to be from your attending physician, from your preceptor. And it's graded on multiple different things: knowledge, professionalism, and things of that nature. Are you able to talk to a patient? Are you able to understand what is going on? And are you able to grasp how to treat certain diseases? Now, as a third-year medical student, you're not going to know everything, and most of the time you're going to have an I don't know answer. But the big thing they want to see is that you're willing to learn and you're willing to go look it up, so that tomorrow, when you do round on the same patient, you have a better understanding of what is going on with that patient. The biggest thing that I've noticed is that if you tend to work hard, that will overcome all of your other academic problems as a third-year student. And then shelf exams at the end, they are graded at UMHS, pass, fail. And you need to be in the 50th percentile to pass the exam. And as far as the letter of recommendation, it really is dependent on really dependent on the student. If you want to go into family medicine, it is wise to get family medicine letters of recommendation, where you are proficient and were a good student at these rotations to get good letters. But if you wanted to do surgery, that family medicine letter of recommendation may not be as useful, because they're completely different fields.
Okay. So let us understand this. So your grade in rotations is a combination of your on-site performance as well as your shelf exam. So what happens to a student if, unfortunately, they're not able to pass a rotation? Does the student redo the rotation? Is there a new opportunity to sit for examinations? What kind of scenario could they be put into if that should happen?
If a student was unfortunate enough to fail a rotation, or to fail an exam, a shelf exam, they're given a second chance to take the exam. You're given 2 chances at per shelf exam, and if you do fail both times, you are required to repeat the rotation.
So if it comes to the case where you have to repeat the rotation, is it fair to say that a medical student could essentially delay other rotations and eventually possibly delay graduation of the MD degree?
Absolutely. Depending on your time structure and when you are able to start rotations, you have 78 weeks of rotations to get done, and you need to get them done by May of the year that you are going to graduate. So if you do fail, for example, an internal medicine rotation, which is 12 weeks, you will have to repeat that at some point. And sometimes that can be a little hectic if at the end of the year, the timing issue.
If you don't finish before May, you mean?
If you don't finish before May, you won't have enough time to get ECFMG certified, and a residency program will not accept you. So you will have to then decline your ability to take that position and apply again the next year.
So this will actually delay your submission into the residency match service, essentially.
You can apply to the match service, that's fine, but if you do not complete all of your rotations, you're unable to then become a resident because you have not fulfilled your graduation.
Okay, good to know. Very important details.
Excellent. Thank you so much, Justin.
Thank you. Thank you.
Mr. Eagleson, thank you so much for your time. You've really been great to us today. We know you're a busy man, so I think it's time for us to let you go.
Justin, it's been such a pleasure to have you. We appreciate all of your guidance and your experience. We're very proud to see how far you've come. We wish you the best of success. You shall definitely be a dynamic doctor soon enough. Bravo to you.
Thank you, I appreciate it. I really appreciate the opportunity of being on the show and speaking with you guys and helping educate those that are coming through. Thank you.